Patient care involves a series of activities that clinicians perform. Proof that these services were rendered will be recorded in the patient folder. Let us go through the elements in the TB treatment record, commonly known as the Blue Folder, 2018 version. This folder has 4 pages, namely, front cover, 2 inside pages and the back cover. Let us start with the front cover. It has a space to fill in patient personal details. There is also space for patient category, which details whether this is a new case or had TB before. Disease classification tells us if this is a pulmonary or extra-pulmonary TB. Treatment regimen portions provides the details on when the patient was started on treatment and the regimen they are initiated on. The information on the next of kin or friend also needs to be captured. Opening the folder brings you to the left side of the inside page. The top part of this page is where one captures tests done and test results. Gene expect on the top part, line probe assay and culture, then the smears at the bottom. A part just below the smears results accommodates other tests that were done to diagnose TB. There is also a section to capture medical history, taking stock of known medical conditions and any medication that the patient is currently taking. This also takes note of any contraceptives method that the patient is using. Then the bottom parts talks to HIV status of the patient. If the patient has tested for HIV before, then it should reflect here. But if the patient tests for HIV during this visit, an HIV test signed consent form must be available. The right side of the inside page keeps track of TB drugs taken by the patient. It details the drugs prescribed and issued to the patient during the intensive phase and continuation phase. Now looking at the last page, the folder back cover. We see a section for capture household contacts. These are individuals that the patient shares the home space with. These individuals must to be screened for TB symptoms, and be managed appropriately as per treatment guidelines. All contacts must be registered in the case identification register as well. And, last but not least, is the treatment outcome section. This summaries the treatment journey of the patient, from treatment initiation, monitoring tests and the final assessment results. It then provides the results for this journey as for example cured, treatment completed and many more options available. There can only be one outcome selected by the clinician. This is done on the day the TB treatment is stopped, and this date has to be captured in this folder as well. Then, finally is the section to record patient movement while still on treatment. This part is be completed when the patient is transferred from one health facility to the next while still on treatment. Record keeping is crucial as proof of services rendered. The folder is a legal document that provides details of what was happening while the patient was under clinical care. Whatever is not recorded, then it was not done. In this video, we thoroughly looked into the TB treatment card, covering all 4 pages. Remember that clinical notes still need to be completed with every interaction with the patient. If you enjoyed this video and thought it was useful, you might enjoy the ones in our website as well. Check them out at ASOKA Services website.